at the northwest corner, the official groundbreaking ceremony will take place.
They got that all done while they were through with their little service, so I come right in with the backhoe and start digging. The hospital wasn't there, none of it. It's the bare hillside. You have to get on solid foundation. If you get just dirt underneath it, put all this weight on it, and they build a building on top of it, pretty soon it'll start sinking. You have to get on solid foundation.
Grande Ronde Hospital came from humble but necessary beginnings in 1907. 4 local doctors who until then had practiced the equivalent of frontier medicine began construction on a new facility. They desired a place where they could practice under more controlled and ideal circumstances. After operating at the same original location for nearly 60 years, the Grande Ronde Hospital's entity was converted to a not-for-profit organization, and fundraising began for a new facility. The current location was dedicated in 1966, financed from public funds.
We had a lot of big ranchers that were on the board. They had a lot of money behind that, and that's when it started. I wasn't so much on that end of it, other than give them a bad time, and they'd say, okay, what do you want?
Because of this success, and seeing that the community wanted to be involved in giving to the hospital's board of directors created a pathway for the community's philanthropic involvement. The Grande Ronde Hospital Foundation was established in 1969. Since its founding, the foundation has acted as the fundraising organization and has distributed more than $4.5 million toward patient care equipment and projects for Grande Ronde Hospital and clinics.
Oh, when we got our first Isolette, we had a little baby that was didn't think that it was going to make it. Instead of flying him out and everything, we had just bought the first Isolette, which was, $3,000 something.
The 3D mammography machines. Those have provided such important service to mammography patients in terms of reduced callbacks, in terms of being able to catch cancer earlier, and it's all made possible by the technology in the 3D mammography machines that is really, really head and shoulders above the old technology. And so to be able to provide that technology to our community here, I believe is one of the most valuable things the foundation has ever done.
You know, a lot of people don't realize the foundation's there. You know, it's kind of the, you might say, a silent partner behind all the active role that the hospital has as far as taking care of patients. Treating people and everything, but the foundation plays a role in the fact that they sponsor events, they provide equipment for the hospital in different areas that otherwise we wouldn't be able to acquire through capital equipment purchasing. It's kind of the icing on the cake, that extra and above and beyond what supplies and support that we need for new equipment and new programs, new processes that need to be fulfilled and taken care of at the hospital.
It's to make it over that line over to the next need to provide equipment, services, upgrading the operating room, upgrading mammogram screenings, fixing or creating a helipad for helicopters to fly off to take the patients out. It's something that is needed to meet the vision, the goals, objectives of the Grande Ronde Hospital Board of Directors and the Foundation Board.
I think we're passionate about the hospital and the foundation because we know how important it is for local care, but the foundation is an important part of making things happen.
For people who want to get involved and make a difference in the community, donating to the foundation assures that those funds go to the benefit of the whole county. It's a pretty assured way of making sure that your neighbors benefit from your charity and your contributions.
It's critically important to have a strong foundation for the Grande Ronde Hospital.
It allows people who are not presently patients to go ahead and support a really, really key component for Union County.
And I've been, like I say, at the hospital for 30 years, and I've probably been actively involved with supporting the foundation for over 20 years, my wife and I. It's been great. I think the foundation has supported many projects at the hospital, some at the rehab department level that we've been very appreciative of.
Along with financial gifts, and just as significant, hundreds of material donations have also been given. Blankets, stuffed toys, and gift bags for patients of all ages have been donated to make them feel more at home and able to pass the time more comfortably when visits require long hours. We honor those who have sacrificed and supported Grande Ronde Hospital since its beginning. They are a unique group of people, and they have room for you. Join them as they continue to build a solid foundation that supports and maintains strong, reliable, and local health care.